Good afternoon, Dr. Megan Smith on behalf of the Connecticut Hospital Association. I appreciate the opportunity to testify on House Bill 7214 pertaining to maternal health. CHA supports sections 1 and 2 of this, 1 and 3 of the bill pertaining to the Perinatal Mental Health Advisory Task Force and the creation of the Hospital Doula-Friendly Advisory Committee. CHA opposes section 2 of the bill pertaining to the creation of a maternal health equity report card. The opposition centers primarily around issues of data validity and availability, and also issues of patient privacy and and current ongoing efforts on maternal health equity in the state. Specific to data availability, the bill around the report card asks for information reported by patient race and income. And hospitals currently do not collect data on patient income. This would require patients to disclose their income to hospitals prior to care or during care. Also pertaining to data availability, the report card calls for the use of qualitative data on maternal health equity. These are data that hospitals also currently do not collect in a systematic manner and would require the use of qualitative data software and employment perhaps of qualitative data researchers and staff. In terms of data validity, the report card proposes creating hospitals as either equitable or inequitable pertaining to maternity care, or giving a grade of A, B, C, D, or F around equity. We are not aware of any national committee or task force or scientific body that has determined what is equitable or inequitable maternal care. And thus an arbitrary designation could in fact exacerbate inequities and mask the root causes of inequities and also potential solutions. In terms of patient privacy, the current reporting for the Maternal Mortality Review Committee in the state and the current reporting to the DPH adverse events around maternal health does not require reporting on facilities or hospital name. And this is primarily to protect patient privacy so that mothers involved in a maternal death or a severe maternal morbidity incident could not be re-identified. Finally, we want to call attention to ongoing efforts in the state on maternal health equity, where there are a significant number of data indicators already being collected that pertain to issues of inequities by race and income. One example is the Pregnancy Risk Assessment Monitoring System currently in place with Department of Public Health and the CDC. Another example is the Reproductive Justice Alliance data that's qualitative focus groups on patient experiences of care, implicit bias, and discrimination. And finally, the Connecticut Hospital Association has a 4-part maternal health strategy that we are deploying with hospitals in partnership with Department of Mental Health and Addiction Services and Department of Public Health that involves training of providers on implicit bias and discrimination in maternity care. Thank you for your consideration.
Thank you very much for your time with us today. And I just want to confirm that you have also submitted written testimony.
That is correct. Thank you.
Wonderful. Questions, Senator Anwar?
Thank you so much, Dr. Smith, for your testimony. Dr. Smith, help us understand, because there's a perception amongst the mothers who have been through healthcare system where they feel that the healthcare system was not respectful of them based on some protected classes. And there's some healthcare facilities that go above and beyond to make sure that everybody feels at home, and others do not. And how do we measure that in a manner that would be acceptable to Connecticut Hospital Association, but at the same time highlight that some hospitals are doing better than the others?
So, I appreciate the question, and I think that it's important to highlight, one of the pieces of the Hospital Association's maternal health strategy is to ensure that the voices of those giving birth are included in their care. And that is, because different hospitals organize care differently and serve different populations, that strategy is really centered around training on implicit bias. An example is the incorporation of the CDC Hear Her campaign, which is centered on implicit bias. And we are currently talking with DPH as part of the AIM, Alliance for Innovation in Maternal Health Award from HRSA to the state, as really incorporating the Hear Her campaign across the state. And so I think, we can measure, for example, the level of training that is conducted at each hospital. There is also the birthing friendly hospital designation that CMS imparts, which is every hospital participates in the Connecticut Perinatal Quality Collaborative, which is very focused on addressing discrimination and implicit bias in care. And then also that hospitals participate in the Alliance for Innovation in Maternal Health, or the AIM, patient safety bundles. Currently, birthing hospitals are implementing the AIM hypertension safety bundle, and then have plans to implement the perinatal mental health conditions and substance use disorder safety bundles. And as we know from our Connecticut data on maternal mortality and morbidity, perinatal mental health conditions and substance use disorders are, large drivers of inequities in our state and of maternal health in our state. So I think measurement can center around training, and it could also center. We are already looking at hospitals that are implementing the AIM bundles and are participating in that work.
Thank you for your answer. If I may say that some of that appears more of a status quo in some respects, and then perhaps a little bit more clinical in depth, but it's not. The status quo is already showing that the black and brown mothers are not feeling comfortable. So we have to do something different. And I love the fact that you're looking at the clinical outcomes data, which is important and perhaps a very critical part of the outcome measurement. But we are talking about how they are made to feel. And that's a different situation. And the questioner in question is, how is somebody feeling that they are welcome and they're being treated as equal?
Yeah, thank you, Dr. Omar. I appreciate the question. And I think one of the pieces that hospitals have in place is the patient and family advisory councils. And there are certainly efforts at the birthing hospitals to really focus with those councils on doing exactly what you say, and really using best practices, again, from the Alliance for Innovation in Maternal Health safety bundles, to ensure that patients are feeling welcomed and heard. And I think that's also, so using the patient and family advisory councils to really specifically focus on the birthing experience can certainly help to do that. And again, that's part of what ACOG's AIM initiative is really focused on, including the voices of those, who are giving birth in their care. I think the other piece, in addition to ensuring that patients feel welcome and respected and heard, and that's why we really want to look at campaigns like the Hear Her campaign and deliver that statewide. I think another piece of this is when we focus so specifically on the birth event, we don't want to disregard the whole entire life course of the mother. And we know that it's so important to think about the health of the mother prior to pregnancy, during pregnancy, and also in that postpartum period. And so another part of the Connecticut Hospital Association maternal health strategy is to also really focus on those upstream root cause drivers of maternal health, like discrimination and implicit bias and economic inequality, and really focus together with our communities about how we can address those upstream root cause drivers. So that's certainly another piece that's central to the work of birthing hospitals, in addition to the part I mentioned about ensuring that patients feel respected and heard.
Thank you so much for your answers, and we look forward to working with you as well. So back to you, Madam Co-Chair.
Thank you, Senator Representative Belton.
Thank you for all of that information. My question for you is, do you feel like we're doing enough to collect data to improve the quality care for birthing people?
I appreciate the question. Again, alluding back to the Connecticut Hospital Association's maternal health strategy, the fourth part of that is actually really focused on data collection and thinking about optimizing data collection. And we took that directly from some of the national reports at the time, focused on the fact that as a country, we're not doing enough to collect data in general in maternal health. And so we have, again, as part of our work on the Alliance for Innovation in Maternal Health, really begun a quality improvement cycle around data collection for certain indicators of maternal health care. And so the examples are around hypertension and really the time to treat for hypertension. And then when we plan to incorporate the perinatal mental health conditions bundle and substance use disorder bundles, those would be additional areas that we're exploring and collecting additional data on maternal health care.
Thank you, Representative Belton. Just to follow up about one of the programs, you were talking about the CDC Hear Her campaign, but you also talked about HRSA funding. Has that funding remained steady, or have you heard anything about that in recent days?
Sure, I appreciate that question as well. So what we've heard is that that funding is here, and is we do anticipate that there will be a contract with the Department of Public Health that would allow us to implement the additional AIM patient safety bundles.
Thank you for that answer. Seeing and hearing no other questions, we appreciate your time with us today. Have a great day today.
Thank you very much.